Cardiac medications, Mrs. McGee. The first classification of medications that we're going to cover are lipid medications or lipid lowering agents. What happens with lipids when they're in your body? Lipids are fats, and fats build up inside your vessels. This leads to atherosclerosis, which causes hypertension and congestive heart failure. It can be genetic, and there are two types of lipids, LDLs and HDLs. LDLs are the bad lipids, and HDLs are the good lipids. You can see in the pictures, a healthy artery has no lipid or fat buildup, and then it starts to get some plaque buildup, and then finally it blocks the artery, causing high blood pressure. Here we are with some non-pharmacological lipid lowering ideals. Decrease smoking. We say that every time. Decrease dietary fats and cholesterol. Avoid stressors. Exercise regularly. And maintain a healthy weight. This is an index card for those of you who use index cards. The first classification of medications under the lipid lowering category are going to be the statins. These cause the liver to make less cholesterol. Your examples are atorvastatin, simvastatin, pravastatin, and rosuvastatin. If you can see, this has a common suffix for you to identify them in their generic form. In their brand names, it's Lipitor, Zocor, Pravachol, and Crestor. Write these down and know what your examples are. These medications are best when taken at night before bed. Their side effects include myalgia, which is muscle pain, but that muscle pain can lead to what's called rhabdomyolysis, is when your body is actually breaking down the muscles and causing muscle destruction. The next classification are called bile acid sequestrants. They decrease the bile acids that bind to cholesterol. Increase the bile acids that bind to cholesterol. Your example medications are Questran and Welchol. They are available in a powder form. They need to be taken with a full glass of water. And make sure that that's water. If you can see in the picture here, if you use those with a carbonated beverage, it becomes excessively foamy and difficult to ingest. The next one are called fibric acid derivatives, and they actually speed up triglyceride removal. Their example medications are Lopid and Triglid. There's a huge liver failure risk with these medications, and they can cause vitamin deficiencies. Now, moving on to CHF medications. CHF medications help when you have chronic or congestive heart failure. So how this happens is chronic heart failure causes stress on the vessels in the heart, and that equals a weak muscle, so a weak heart muscle. And when you have a weak heart muscle, we have a failure to push the blood out into the body. There is no cure for congestive heart failure, but you can give vasodilators or cardiac glycosides to help with the symptoms. Here are some signs and symptoms of congestive heart failure. If you don't know these already, this is another index card for you. Shortness of breath, swelling of the feet and legs, chronic lack of energy, difficulty sleeping at night due to breathing problems, swollen or tender abdomen with a loss of appetite, cough with a frothy sputum, increased urination at night, confusion, and/or impaired memory. So vasodilators can be given for CHF. The example medications are listed there for you as Isorbid, Mdur, and Apresyline. Vasodilators dilate, which means to widen, the blood vessels. This makes the blood flow easier, therefore decreasing blood pressure. They're given both for congestive heart failure, hypertension, and angina, because angina is the closing of the coronary blood vessels. Oxygen is considered a vasodilator. Side effects include chest pain, palpitations, increased heart rate, fluid retention, nausea and vomiting, dizziness, headache, and flushing. Cardiac glycosides strengthen heart contractility. They make the cardiovascular system more efficient. Examples include digoxin and lanoxin. They're used to treat AFib or resistant CHF. Side effects can include arrhythmias and heart blocks, but we're going to talk about digoxin more specifically. It's used to treat congestive heart failure and AFib, but it's usually used in conjunction with a diuretic or an ACE inhibitor. It can increase the strength and contractility, the efficiency of the heart, so that it can control the rate and rhythm of that heartbeat. If you look here, this picture is really good and explains a lot of things about digoxin that you need to know. In the purple box, it has that there are two routes, oral and IV. The oral route peaks in 4 to 6 hours, whereas the IV peaks in 1 to 4 hours. That's important to know because this medication can become toxic. So we have to maintain a therapeutic level. That therapeutic level is 0.5 to 2. And if it becomes 2.5 or greater, then it's toxic. This digoxin only works inside of our hearts. It controls some potassium exchange, so we'll want to make sure that we have potassium levels before we take it to have a baseline, and then as the therapy goes on, to make sure that we're not getting potassium out of whack. Then we want to know that our heart rate is not less than 60 beats per minute. If it is, then we're going to hold the medication. Some more information about digoxin. This is a really important medication. If given with St. John's wort or ginseng, both of these actually increase the dig levels. So that could cause a person to become toxic really fast. The therapeutic range is listed there for you again. The antidote for digoxin is Digibind. It's Digibind. So it just binds the digoxin and takes it away. The potassium levels, I said that you needed to check those. Do not crush any digoxin. We're going to take an apical pulse when we're giving digoxin. We're going to listen to it for 1 whole minute. There's no estimation. We don't want to give this medication if our heart rate is less than 60. Adverse effects of this medication can include bradycardia. That's why we really want to pay attention to this heart rate. The bradycardia can actually lead to a complete heart block. A complete heart block is when there's no electrical stimulus for the heart to beat. If the heart doesn't beat, it doesn't do its job, and there's no blood flowing anywhere. Now we're going to talk about angina medications. Angina medications include beta blockers, calcium channel blockers, and nitrates. For a refresher, angina means that you have insufficient blood flow to the heart due to narrowing of the coronary artery, and that causes chest pain. So there are really common precipitating factors. That means something that happens prior to having an angina attack, and usually some sort of exertion like exercise or eating, or emotional distress, or extreme temperatures of the hot or cold. Nitrates are nitroglycerin, or isorbide. These relieve and prevent angina. This picture explains a lot of information about nitroglycerin. This little guy down here holding the dynamite just lets you know that nitroglycerin really is taken straight out of construction, and it can blow up even in the medication form. It can be quick or slow release. Your side effects include severe hypotension, tachycardia, dizziness, headache, and syncope. With your quick release down here on the left-hand side, you can have sublingual tablets or sublingual spray. There's slow releases in nitro patches, nitro ointments, and sustained release caplets. The most common side effect for nitroglycerin is a headache. Alcohol mixed with nitroglycerin can cause severely low blood pressure. This is another medication that we have parameters for our vital signs. And that means that we're going to hold this medication if the heart rate's less than 60 or the systolic blood pressure is less than 90. The routes of administration for nitroglycerin, there are so many because it's used so often. Sublingual tablets, sustained release oral caplets, transdermal delivery system, translingual spray, topical ointments, intravenous infusion, tons of different things. Now we're going to talk about arrhythmia medications. These are given for when the heart is out of rhythm and is not beating properly. Types of medications that we can give are beta blockers, which slow down the heart rate, or calcium channel blockers that can help very rapid arrhythmias, sodium channel blockers, which control supraventricular rhythms, and then potassium channel blockers, which can control ventricular or supraventricular rhythms. Here is just a short explanation of some EKG rhythms. Some of us have been talking about them already. Just look at these, be familiar with them. We're going to talk about the third one down, Torsades de Pointes, here in just a second. Know the difference between them. Normal sinus rhythm is at the very bottom. And if you look, this is color coordinated. The very bottom is green, normal sinus rhythm. That means you're good to go. Your heart's great. It's not going to kill you. And then as you get up higher in the red and it gets redder, that is the severity of this rhythm. And what it can cause is death. The top 3, you can see that yellow, shockable. That means these are shockable rhythms, and we would shock the patient's heart back into rhythm if we can't cure it with medication. The first one we're going to talk about are called sodium channel blockers. Your examples are Rhythmol and quinidine. These decrease the rate and the force of conduction. They treat chronic angina as well. Side effects can include diarrhea, nausea, headache, dizziness, and those anticholinergic effects. You should remember those, but if you don't, this is an index card for you. Anticholinergic effects include tachycardia, dry mouth, urinary retention, blurred vision, and constipation. Now we're going to talk about potassium channel blockers. These are antiarrhythmics and vasodilators. Your example medications are cortisone, Ticasine, and beta-pace. Side effects for these medications include lightheadedness, GI distress, anxiety, and insomnia. There's one huge adverse reaction called Torsades de Pointes, and we talked about that on this slide, it's the third one down, it is a shockable, deadly rhythm. So we don't want that to happen just because of the medication we're giving. Don Corderone, the enforcer. They use me to protect you from recurrent life-threatening ventricular fibrillation and ventricular tachycardia by decreasing the cardiac conduction and audiomaticity. All right, so that means that it helps the ventricles contract correctly. Be careful with this medication. It can last a very long time, the effects of it. So we're going to monitor for progressive pulmonary problems such as dyspnea, decreased breath sounds, cough, and rales. Other side effects include bradycardia, AV block, hypotension, and visual problems. This is just a reminder, foods high in potassium include avocado, banana, potatoes, spinach, beans, citrus juices, and fish. We're going to talk about emergencies. Shock medications are available in emergency to help you save a life. Remember your different types of shock. You have hypovolemic, cardiogenic, neurogenic, and anaphylactic and septic. Please look at these and remind yourself of this information that you've already learned. So those medications that we use during a shock situation are called vasopressors. The examples are epinephrine, Dobutrex, and dopamine. These actually contract blood vessels. So they do the opposite of vasodilators. Instead of dilating, they make the blood vessels smaller so that it increases blood pressure. So that makes sense that we give these medications when the patient's blood pressure is extremely low, which happens often in critical illness. Side effects include decreased heart rate, cyanosis, sudden numbness, weakness, or cold in any part of the body, dyspnea, decreased or no urinary output, and skin issues like pain, irritation, or discoloration. These guys are very serious medications, and that's why they're only given in a critical care setting.